I didn't expect to find this in a brain scan, but 3 years ago, I was reviewing the vascular imaging of a 68-year-old patient, checking for small vessel disease, the kind that quietly damages memory before anyone notices, and I kept staring at something unrelated: the walls of her tiniest blood vessels. Thin, less elastic than they should have been. And it was the exact same structural collapse I'd later see, almost identically, in a dermatology colleague's slides of aged skin tissue. Same protein, same collapse, different organ, and what I'm about to explain may change forever how you think about wrinkles, sagging skin, and what's actually happening under the surface after 65. My name is Jennifer Hartley. I'm a board-certified neurologist with a subspecialty in geriatric neurology, what we call neurogeriatrics. I've spent over 14 years doing one thing: evaluating the aging process in adults over 60, mostly through the lens of the brain. I've reviewed thousands of vascular scans, interpreted hundreds of MRIs in older adults, and along the way, I noticed something most skincare experts never get to see. Collagen doesn't just hold your face together, it holds your blood vessels together, your joints together, your gut lining together. When it breaks down in one place, it's breaking down everywhere, quietly, consistently, invisibly, until the mirror shows you. Here's what almost nobody explains about skin aging after 65. It's not sun damage alone. It's not simply getting older. It's a specific breakdown in how your body handles water at the cellular level, combined with a collagen production system that has slowed by roughly 65% compared to your 30s. Think of your skin's collagen matrix like a sponge held open by a scaffolding. Hyaluronic acid holds the water, collagen fibers hold the shape. After 65, that scaffolding thins by about 1.5% every year, and the sponge starts collapsing in on itself. That's the sagging, that's the crepe-like texture. But here's the part that took me years of cross-referencing vascular data to fully appreciate. Your skin has its own microcirculation, tiny capillary networks that deliver water and nutrients to the dermis. In my patients over 65, I routinely see a 30 to 40% reduction in dermal capillary density compared to scans from the same patients in their 40s. Fewer delivery routes, less water reaching the tissue that needs it. It's not a moisture problem on the surface. It's not a fat loss problem underneath. It's a structural collapse of the water-holding architecture in the dermis itself, compounded by a delivery system that's already running at a fraction of its former capacity. And the hidden villain here is something almost nobody connects to skin: chronic, low-grade cellular dehydration, made worse by the common blood pressure medications and diuretics so many of my patients over 65 are already taking without realizing what it's doing to their skin's water reserve. I've had patients on the same diuretic for 11 years who never once heard a doctor mention what it does to their skin's ability to hold water. Before I go further, I need to be very clear, because when we're talking about the skin of someone over 65, the details matter. Stop and see a doctor today if you notice sudden skin discoloration that wasn't there yesterday, if a mole or spot has changed shape or started bleeding, or if you have open sores that aren't healing within 2 weeks. If your situation looks like that, this video isn't for you. You need an in-person evaluation today. If it looks more like ordinary thinning, sagging, or fine lines that have crept in over the past few years, keep watching. This was made with you in mind. I had a patient, I'll call her Margaret, 71, a retired piano teacher who still paints watercolors most afternoons. She came to my clinic originally for a memory evaluation, worried about her mother's history of dementia. Her scans were fine, but she mentioned, almost as an aside, that she'd stopped looking at her own hands while she painted because she didn't recognize them anymore. Thin, crepey, bruising if she so much as brushed against the easel. She'd tried creams, serums, a jar of something her granddaughter ordered online that promised results in 2 weeks. Nothing changed. During our follow-up, I asked about her daily water intake, and she said something I've never forgotten. "I drink plenty of water, I just don't think my body wants it anymore." That sentence unlocked the whole picture for me. Her body wasn't absorbing the water she was drinking. It was passing straight through because she had nothing in her system helping her cells actually hold on to it. I ran a simple skin turgor test in the office that day, pinching the skin on the back of her hand and timing how long it took to flatten back down. 9 seconds. In a healthy 30-year-old, that's under 2. I explained what I suspected, and we adjusted one thing. Just one. Not 5 things at once. Margaret was already overwhelmed managing blood pressure medication, a statin, and a calcium supplement, and I didn't want to add complexity she couldn't sustain. 8 weeks later, she came back, held out her hands under the exam light, and said, "I can paint again without looking away." I ran the same pinch test, just over 2 seconds. I had to look twice myself. Has your doctor ever told you that sagging skin after 65 is just part of getting older and left it at that? Write it in the comments. I want to know how many of you have heard exactly those words. So here are the 5 things I walk my own patients through, starting with the one everyone asks me about first. Number 1. Hydrolyzed collagen peptides added to water, taken with vitamin C. I know what you're thinking. You've tried collagen powder before and noticed nothing. Hear me out. Collagen synthesis requires vitamin C as a cofactor for the enzyme that stabilizes the collagen molecule. Without it, the peptides you're drinking are mostly wasted, passing through your system as unused amino acids. Protocol: 10 grams of hydrolyzed collagen peptides dissolved in water, combined with 500 milligrams of vitamin C, taken first thing in the morning on an empty stomach. Not with coffee. Caffeine interferes with absorption. Give it at least 4 weeks before you expect to feel a texture change, and 8 to 12 weeks before you see a visible one. This isn't instant, and patients who quit at week 2 are quitting right before the effect becomes noticeable. Avoid this combination if you're on blood thinners without checking with your doctor first, since higher dose vitamin C can interact. Number 2. A pinch of mineral-rich sea salt or an electrolyte packet added to your morning water. I know this sounds backwards. Everyone over 65 is told to cut salt. Hear me out. Without adequate sodium and potassium, water you drink can't actually cross into your cells. It just gets filtered out by the kidneys, which is exactly what was happening with Margaret. Protocol: 1/8 teaspoon of a mineral-rich salt or a low-sugar electrolyte packet in your first 16 ounces of water each morning. Skip this one if you have congestive heart failure or kidney disease. Talk to your physician first. This single change is often the reason collagen protocols start actually working, because it's solving the delivery problem, not just adding more raw material. Number 3. Hyaluronic acid taken orally, not just applied topically. I know, you've seen the serums, the jars promising a plumping effect overnight. Hear me out. Oral hyaluronic acid increases the water-binding capacity of the dermis from the inside, something topical application can't reach past the surface layer, because most topical molecules are simply too large to penetrate beyond the outermost skin barrier. Protocol: 120 to 240 milligrams daily, taken with a meal that contains some fat for better absorption. Generally well tolerated, but avoid if you have a history of hormone-sensitive cancers without discussing it with your oncologist first, since some early research suggests hyaluronic acid may influence tissue growth signaling. Number 4. Timing your water intake around your circadian rhythm, not just drinking whenever you remember. This is something I don't think anyone outside a sleep and aging clinic talks about. Skin repair and collagen synthesis peak overnight during slow-wave sleep, the same window your brain uses for its own repair processes. The two systems run on the same clock. Protocol: front-load 2/3 of your daily water intake before 4 p.m., tapering off in the evening so you're not disrupting sleep with bathroom trips, since fragmented sleep itself suppresses growth hormone, and growth hormone drives new collagen production. I've had patients tell me this one change alone improved their skin more than any product they'd purchased, simply because they stopped waking up 3 times a night. If you have a condition causing nighttime urination already, focus on daytime timing rather than restricting evening fluids further. Number 5, and this is the one I consider my own clinical signature: adding a small amount of silica-rich water, like mineral water naturally high in orthosilicic acid, to your daily intake. I know silica sounds unusual. It's not something you'll see on a skincare shelf. Hear me out. Silica is a required cofactor for the enzyme prolyl hydroxylase, which is what actually cross-links collagen fibers into a stable structure. Without it, new collagen stays weak and disorganized, like scaffolding poured without rebar. This is the piece almost every collagen protocol skips entirely. Protocol: choose a mineral water naturally containing 10 to 30 milligrams per liter of silica and use it as your primary drinking water for at least 12 weeks to see structural change. This is generally very safe, though those with severe kidney impairment should discuss any new mineral intake with their nephrologist first. I want to pause here for a moment because there's something important I need to say as someone who studies aging for a living. All 5 of these strategies work through the same underlying mechanism: restoring your cell's actual ability to hold onto water at the structural level, not just hydrating the surface. That's collagen peptides with vitamin C for the raw material, electrolytes so the water actually gets where it needs to go, oral hyaluronic acid to hold it there, circadian timing so your body can use it for repair, and silica to lock the new structure in place. 5 doors, 1 room. Don't try all 5 this week. Your skin doesn't need more sudden changes. It needs one change done right and done consistently. If I had to tell my own mother where to start, I'd say the electrolyte adjustment first, because it costs nothing and fixes the delivery problem underneath everything else. Then build from there. One protocol every 2 to 3 weeks, so you can actually tell what's working. I've seen patients in their late 70s rebuild visible skin structure they were told was simply gone for good. It is never too late to change how your body holds onto water. Margaret still paints every afternoon, and she looks at her hands while she does it. Which of these 5 are you going to try first? Tell me in the comments. I read everyone. And if this helped you or someone you love, please share it. There are people in your life right now who think sagging skin after 65 is just something you have to accept. If you're new here, consider subscribing. I cover topics like this every week. Everything I shared today is general health information based on current science and my clinical experience. It is not a substitute for personalized medical advice from your own doctor. Do not start any new supplement without speaking to your physician first. In older adults, that can matter more than people realize. Bring this conversation to your next appointment. Your doctor is your partner in this.